I just wanted to introduce myself. I'm Ash. I run the core surgical training interview course. And I just want to put out a few disclaimers before I begin this free webinar. I don't work for the JCST, for the foundation program, for core surgical training, for Royal College of Surgeons. All the opinions here are our own, both myself, Megan, and Aman, who will be speaking. And we can't answer certain questions on, for example, why the MSRA was introduced. These things we don't know the answers to. We're just going to try and help you in this next hour come to terms with the core surgical training interview, at least the best from our knowledge. So the core surgical training application, I mean, it starts now, really. The earlier you begin, the better off you'll be. And although the actual recruitment timeline isn't formally out, you can kind of make your best effort guess as to how it's going to run. On the right, you can see that's how it ran last year. Oh, sorry, that's how the Health Education England have released the interview recruitment timeline for all specialties. And then the table on the left shows how it will be running or how it ran last year. So you can kind of extrapolate exactly how it's going to be this year. And that can give you some idea of how you're going to best prepare for it. I think the most important things to note are the self-assessment. So the self-assessment is something that you've actually been preparing for probably since your time at medical school, whether it's your projects, your audits, your research projects. Now that we're coming towards the back end of your preparation for the core surgical training interview, there are still points you can get, but the majority of the hard work should have been done and will have been done. One of our allegiances with MedCourse, which is a great course, great website out there, which really brings all courses together, has released a blog on the core surgical training interview portfolio self-assessment scoring guide. I've added to that, I've contributed to that, and it's really good for how you can collect some points, especially if there are any F1s or people who are planning on doing an F3 or anyone who's got a little bit more time before the interview. That's going to be extremely useful for you guys. The 2022 self-assessment scoring guidance is out there. You can use that as a guide, but as we see every year, it does change slightly, but it'll be very useful as a reference point to see where you're up to and what you could score potentially more points on. So the core surgical training interview itself, for those that get shortlisted, which are the majority of people who have a good self-assessment and will do well on the MSRA, will be shortlisted. You've also got to remember with the MSRA, it's the first time all of you will be doing it. So you're all in the same camp. So really preparing early will give you the advantage over literally everyone, because no one would have been preparing about it till it was announced. So playing the game, this is the first part of playing the game. There are a lot of tick boxes, there are a lot of hoops to jump through, but at the end of the day, you all have to jump through those hoops. So there's no real way around it. There's no one that gets into core surgical training without doing the interview, without doing the self-assessment. So moaning about it, not preparing for it, you're only doing yourself a disservice, because the majority of you are wanting to get the job. You're giving up your evening to join this webinar. So don't fall at the last hurdle. Start doing as you're supposed to do, and how we have all done it. Does anyone know this film? The picture? Anyone just shout out the answer. I might be showing my age.
Is it 21?
21.
I'm not sure who said that, but whoever did, can you give like a 1-sentence or a 2-sentence summary of what the film was about?
I think essentially playing the game.
Playing the game, yeah. So for those that haven't seen the film, or who are too young to have seen the film, or who just have a real objection with Kevin Spacey, quite rightly, it's a film about a group of Harvard students. I'm pretty sure it's Harvard. It might be MIT based on a hoodie. I can't even remember myself, but they're highly gifted students who learn to count cards, go to blackjack, go to Las Vegas to play blackjack, end up doing extremely well. And obviously card counting in Vegas is frowned upon. It's not really allowed. But the reason I use that analogy is you guys preparing for the interview early, doing it the right way, and we'll go on to how I mean by doing it the right way, is giving yourselves that exact advantage for those that don't prepare, for those that haven't really put in the work for the interview. And what I mean by that is practice like you mean it. It's an interview and it's not an exam. So it's not something where you can just read as much clinical information as possible and expect to do well. You really need to practice speaking, and that's speaking into a camera, reflecting on what you see. So record yourself and then try and improve for the next time. See where you are where your flaws are, whether that's in the way that you speak, whether that's in your lack of knowledge, whatever it is. We all have flaws. It's not something to put yourself down over. It's something to try and improve on for the interview. And that's what only you can really do. Of course, get together with a group of people, practice, criticize with each other, constructively, obviously. And that's really the way you get better at interview and OSCEs and verbal exams. And this is an interview. Remember that there's a personal element to it, which we'll come on to as well. Don't procrastinate. There is so much stuff you can do to avoid actually preparing for the core training interview. You can even now rank every job based upon what you can see from last year. You can go on Twitter and see how difficult it is to get into core surgical training interview. You can see how many more applicants there are than a few years ago, how it's so much more of a competitive all of these things at the end of the day are a bit of a waste of time. The only thing that you really should be focusing on is trying to do as well as you can on the interview day, because that's what's really the only thing that's going to help you get a job. And think like a surgeon. So over the next few weeks, months in your jobs, whether that be a medical job, an A&E job, surgical job, whatever you're doing, thinking like a surgeon really is more something you gain with experience, but it doesn't mean you can't gain it now in the early years of your training. And what I mean by that is seeing there's a lot of things that are gray in medicine, but there are a lot of things that are also black and white. And that is the initial investigations for certain problems, the definitive investigations, the initial management plans, the ABCDE. Thinking about those things when you see patients, when you're in handovers, when you're making referrals, that's thinking like a surgeon. And the more you can speak about that proficiently, the better you're going to do in your interview. Remember, all of the stations have the same points. So spending all of your time from now till your interview learning the MRCS syllabus and making sure that your clinical knowledge is great may be, again, doing yourself a disservice in the management station, which holds the same number of points and is actually deemed as a bit of a differentiator station, because the clinical knowledge for the majority of you will be of a high standard, or of a satisfactory standard as per what's required for core surgical training. But there's a huge discrepancy in how people address the management station, their leadership interviews, leadership presentations. So working on those with the equal amount of time will help. And again, we'll go on to how you can really prepare for those stations. And make sure your presentation is flawless. Again, they may change it. You may have a different title to the presentation. You may not have a presentation at all. Whatever the case is, if you start preparing at least nice and early now for what happened last year, you're at an advantage if they do it again. If they don't, you haven't really lost anything. So there's no real reason why, if from now, in fact, even from last year, you knew what the presentation title was, there's no reason why it can't be flawless. That doesn't mean it's robotic, but why it's not well prepared, well rehearsed, and well delivered. So the logistics of the interview, again, I'm going to go off what happened the last 2 years, and that was virtual. They may revert back to face-to-face. There hasn't been an official announcement, at least to the best of my knowledge. So if it is virtual, it's on Microsoft Teams, and make sure you test everything out. I think Megan is going to be much better placed at discussing this with you guys as she went through the virtual interview. But there is a link that's sent to you. Make sure your lighting and sound is great, that your angle is great. I don't think mine is actually today. I'm in a different station to where I normally am, but make sure that you have all of those things prepared. And that's not just the hour before your interview. It's the few days before your interview, in case you need to change something, in case you need to go to the library rather than your apartment or house because your network isn't very good and you just don't want it cutting out. Whatever it is, you should really prepare for it. And there's loads of videos on YouTube as well on how to make sure that everything is in the correct setup so that your head ratio is correct, whatever it is. Those links are much better than anything that I could tell you. There's also an identity confirmation in a showroom, at least there has been in the last few years. Be familiar with all of these things so that you're not flustered when these things happen on the actual day. Just make sure that you can take everything in your stride, because really, on the day of the interview, at the time of your interview, the only thing you should really be thinking about is the interview itself, not these logistical things and the angle of your camera and whether your sound is projecting well enough. That should all be done so you can really focus on the interview. This is kind of the setup. I mean, I just got this photo of Google, but something like this is good. Then the actual interview itself. This is really the make or break for a lot of you. You would have done the hard work in the self-assessment. You would have done well on your MSRA, and you get to the interview. And doing well at the interview really is what I want to talk to you about, at least in the next 5 minutes or so. And that is the structure, which is in the applicant handbook. So you've all got access to that. This is not new information. This is not secret information. This is all there. So you should all be prepared for this. And that is, again, the 2023 handbook will be released, I imagine, shortly. But at least from the 2022 handbook and what's been done in previous years, this is the setup. So you've got your management station with your pre-prepared presentation based on a title that they give to you, with 2 minutes of questioning on the presentation. There's then one management scenario, which is 5 minutes, and there's a number of questions on this. And then finally, there are 2 clinical scenarios, which each last 5 minutes. The marking criteria, again, is in your applicant handbook. This is nothing new, and this is what's given to the examiners, and it's what you're used or what you base how you do well. And if you see it, it's really vague, in fact, from a 3 to a 6. A 3 is satisfactory, a 4 is a good, a 5 is excellent, a 6 is outstanding. And they are literally just words on a piece of paper. So you may be saying, how do I differentiate amongst the 2,000 applicants from being good to outstanding? How do I go from satisfactory to good? These are great questions, and no one really has the answer to it. But again, based upon my experience, again, it's confusing, but based on my experience, it's about how you deliver the answer. It's not necessarily giving the right answer, although the right answer obviously helps, but being structured and having blueprints for all the different types of questions that you may be asked. So a clinical scenario, let's say a right iliac fossa pain, being structured in how you go about that in the emergency department by getting the necessary investigations, whether that be a urine dip, bloods, bedside investigations, radiological investigations, then going on to the differential diagnosis, both your urological differentials, your surgical differentials, your vascular differentials, your gynecological differentials, using those kind of words and that surgical vocabulary in your answer. Again, whether you comprehensively cover every cause of right iliac fossa pain, it's what really, in my opinion, separates those from good to excellent and excellent to outstanding, because it shows not only do you know about right iliac fossa pain, you know about how to think it through. So similarly, when you get anything in A&E, when you're a core surgical trainee or anything whatsoever, you're thinking about it in a systematic and structured way. And that really is what makes a good surgeon, someone who's systematic, surgical, logical, and has evidence behind what they're saying. Learn from others. So you're going to have, again, a huge amount of experience, even coming up to this point, but also up until your interview, where you see other doctors presenting patients, where you refer yourself, where you're in handovers, where you're in trauma meetings if you're in orthopedics. These are great opportunities to see how the people who are deemed good or you think are good, how they speak, and you can try and mimic them, or at least practice with them and try and understand how their minds work. Because at the end of the day, you're not going to be able to be someone else. You shouldn't try and be someone else, but you should try and have your mind working in a certain type of way, at least up until the interview and during the interview. And really, mock interview circuits, they are gold dust. So however you can go about getting mock interview circuits, whether that's from our course, whether that's from other courses, whether that's with practice with friends, they really are the highest yield of practice you can do, because not only do they put you in a scenario that's similar to your interview, but you'll get feedback on that, because the last thing that you want is to go into your interview and that's the first time you've tried to prepare for that interview, or first time you've made the mistakes you're going to make in an interview. So really, those that have huge amounts of experience of mock interview circuits or interview circuits are the ones that are going to be best placed when it comes to the interview. I actually, from personal experience, I went on every single interview course that was running purely for that reason, to gain that experience, because it's all well and good practicing with friends. And yes, you can try and get pinned down 1 or 2 registrars or consultants, and that's all good. And that's stuff you should definitely do. But really, those mock interview circuits, however you come across them, they are worth their weight in gold, in my opinion. On our course, we go through, again, we've got a series of lectures, and we go through these in much more detail, every scenario, every station in detail. We obviously don't have the scenarios that come up, but we go through trauma, we go through post-operative cases and the clinical ones, how to really prepare for them, ED presentations, and I think I've just skipped past it, but also your leadership presentation. So we try and cover as much as we can in our course to try and give you the best advantage by having some structures to work on. So when you go through the resource banks, when you go to mock interview circuits or practice with whoever, you've got some ammo to work with, if that makes sense. To conclude, otherwise I could go on for ages, really you need to practice. Everyone needs to practice as much as possible, and that's with other people, even on your day-to-day clinical work. But when you're making a referral, practice as if you're presenting in a clinical station. You're not going to, if anything, you're going to be better clinically by doing so. Mock interview circuits, I think I've said that phrase about 30 times in the last minute, and for a reason, because they are so good, and you get constructive feedback so you can improve for the actual interview. And your actual interview will then start to feel like one of the mock interview circuits. You're prepared for it. So your nerves, you will of course be nervous, but they won't be as nervous as if it was the first time you were doing it. Record yourself, critique yourself, reflect on the critique that you've given so that you can get better for next time, and just keep repeating that cycle. We're in 2022. You've all got cameras on your phones, on your laptops. Record yourself. I mean, I still am not great, but I still record myself before I give any presentation or anything. So because I know I and I are, and I use my hands a lot, and it's not good. They're things that I can improve. They're things that I can physically get better at without having to read a textbook. And so these are things that you can do from now till then. Be prepared, leave nothing to chance, keep an eye constantly on the Oriel website, the documents that they send, the update, for example, on the MSRA. For those of you that are just learning about it through this webinar, then the announcement of the MSRA is something that has been pretty public knowledge from the JCST and from the MDRS. So it's not new information, but you should be up to date. When that presentation title comes out, you should know that on the day. So it's not something that you just leave and you just check sporadically. It's something that you should be checking regularly. And remember, it's all in your hands. Examiners choose to be examiners and interviewers. They want to see the next generation of surgeons. They want you to be good. They're all given the same briefing of work with a stoic face, try not to give too much away, but they're only there to help. If they ask you things like, is there any other differentials, or do you want to add to that? Normally it's because you've missed something and you need to add to that. And how you answer questions will lead on to your next question. So it is actually in your hands, despite you not feeling like it is. It is all based upon how you answer one question will go on to the next question. And don't forget to smile. It's painful whenever anyone says this to me, so I know how painful this is going to be when I say it to you. But when you come out of that interview, if it goes well, you'll feel like you enjoyed it. You won't enjoy it at the time. No one enjoys it at the time, but you'll look back on it with fonder memories, let's say. So what you prepare from now going forward is really going to be how you do in that interview. So like I said, we run our core surgical training interview course. Our October one is pretty much full. I think there's a few spaces left, but we've just released a new date in January, and based upon demand, which there tends to always be, we'll keep running them. As much as people want them, we'll keep running them, because our focus is to do as many mock interview circuits with you guys as possible, so you're as good as possible for on the day. And that's all available on our website, which you all would have gone on to sign up to this. So don't miss out.